people who think Bernie Sanders is intelligent, and gentlemen. We're going to cover two things here. California's Medicaid expansion. Already covered why California is broke and getting broke. After ObamaCare passed, surprisingly, the Supreme Court ruled in the favor of limited government. They allowed states to shelve Medicaid expansion because ObamaCare wanted to basically create Medicaid for all for everybody under 65. Now, California expanded Medicare, as a lot of states did, and their Medicaid expansion was bigger and badder than most states. At one time, California, the percentage of under 65 people on Medicaid was less than the U.S. average. Well, not anymore. California's Medicaid expansion is on fire. And I'll also cover, real quick, or try to cover it quickly, but we'll go over this just to cover all the bases for you guys. Medicaid was on a tear as far as spending, even before ObamaCare. Some of these progressives out there saying, oh, gave them health care, we're finally spending money on health care we didn't spend before. No. They autistically repeat that crap, but Medicaid was already on fire before then, and Medicaid is a horrible program, which I will demonstrate. Well, progressives, their only talking point about it is, if you're against Medicaid, you hate poor people. No, I don't hate people who have a bunch of kids before they drop out of high school and then all they can do is stock shelves and think they should have more kids and think they deserve like $15 an hour for doing something a trained chimpanzee would do. No, I don't hate those people. Medicaid is a horrible program due to its price controls and just basically everything government touches, almost everything, they turn it to poop. So, without further ado, let's get to this. According to the 2010 census, 88.6% of California's population was less than 65 years old. According to the 2010 census, 87% of the U.S. population was less than 65 years old. I understand these demographics change. I use the census data, though, because that gets it pretty exact. And I just extrapolated that out to 2017. I looked at three times, 2009, 2013, 2017. One time before the Medicaid expansion, one time right before it, and another one just recently after it. So we'll do this again in 2020 when the new census comes out and we have new figures about exactly what percentage is under 65. So California Medicaid enrollment in 2017 was 12,153,496. California Medicaid enrollment 2013, 7,755,381. California Medicaid enrollment 2009, 3,813,011. You can see the figures there for California population. I'll put all that stuff up so you can see what I'm reading off. California population 2017 and 2013 and 2009, and I've got the population that's under 65, and then I've got the California population that's under 65, and then I've got the less than 65 years old percentage on Medicaid, which, there are dual eligibles, by the way, people who are eligible for Medicaid and Medicare. Not too many, but there are some. And then I've, of course, got the percentage, and as you can see, California, the percentage of people under 65 on Medicaid in California has almost tripled since 2009. And you can see the U.S. average in 2009, California was well below that. Well, by 2013, right before the ObamaCare Medicaid expansion, because the first enrollment period started in October 2013, California just shot up above the U.S. average, and now they are way above the U.S. average. So California was already on a tear. Another thing you need to learn about Medicaid, it's a federal program, but implemented by the states and run. There's a lot of taxpayers in Idaho, Michigan, Texas, etc., who probably don't want to pay for free health care for a bunch of people who, some of them are illegal aliens. I'm not against immigration. But what California is doing is they're trying to just pile on as much, because the federal government pays for most of it. And they figure, well, man, we'll just expand this like crazy. Of course, it's going to cost them a lot more money, and they're going broke. But since the federal government shoulders a higher burden of it, they can get taxpayers in Idaho who had nothing to do with their stupid situation to pay for it. And I'm sure those taxpayers in Idaho love to pay for it, which is why we need more federalism. We need more of this devolved down to the states. I would consider Medicaid to be, as far as the Constitution goes, unconstitutional. But then again, we live in an era where we've got idiots like Bernie Sanders who think internet access is a right. So I'm not going to read all those figures off, but you can see those. How I used the 2010 census data and extrapolated that out. Isn't that sad? In the United States, over 1/4 of everybody under 65 is on Medicaid, and in California, it's over 1/3. So, wow, that is quite a sobering trend there. And that's going to cost money, because we don't spend anything on welfare. Well, actually, we spend plenty on it. I've been over that in plenty of videos. Now we're going to move on to some data related to, this is the National State Association of State Budget Officers. I've got all the links down there for all this if you want to read more. As I put up in one of the screenshots, Medicaid spending and adjusting for inflation has been absolutely into the stratosphere. We're going to go over how Medicaid has some data as far as state budgets go. Medicaid has grown exponentially. We'll go over that next. Again, folks, don't forget to check the two videos that I'm referencing at the start of this section, two videos I did on Medicaid, demonstrating why the price control keeps people from finding doctors and the exploding costs of it. Which neuters the progressive mantra that we don't spend enough. We never spend enough. Progressives on healthcare are like Republicans on the military-industrial complex. No spending is sufficient. No amount of wars is sufficient. It will never be sufficient. So you can't please pukes like that. So, 1992, this is all NASBO data, just arbitrarily selected. In 1992, total Medicaid spending, excluding administrative costs, totaled $101.9 billion, or 33, a full third percent more than the 1991 level. Wow, that's a massive increase just in that 1 year. Medicaid spending increased 23.7% between 1990 and 91. So you can see Medicaid spending was already going through the roof long before Oboingo came along. 44 states experienced double-digit growth in total Medicaid between 91 and 92. It is not surprising, this is something we'll look at a few times, it is not surprising that Medicaid expenditures have increased as a percentage of total state expenditures, rising from 10.2% in 1987 to 17.1% in 1992. And if you look at the trend of state spending, it's not going down, adjusting for inflation. No, it's look at any 10-year period and it's going through the roof. The funny thing about looking through all this NASBO data, if I had $1, every single time I watched them, I read them, something on there saying state revenues have flattened out, have flatlined. State revenues haven't grown as much as projected. State revenues are down. State revenue. They are always pleading poverty. Holy moly. And I added this one. Vermont's Healthcare Authority. This is back in 1992. Vermont's Healthcare Authority is developing a statewide spending target this year and a unified or global budget by July of 94. The authority is also responsible for designing two alternative access plans, a single-payer system and a regulated multi-payer system. Regulated, of course. And how long has Vermont been flirting with single-payer health care? And how long have they, I just can't do it. But they'll vote for a national one to where then the costs are shifted around. And the costs can be shifted to the federal government. As you can see, back then, federal funds were 57.7% of all Medicaid expenditures. So they can just, who's going to bail out the federal government? And as you can see from my other videos, I went over why, ever wonder why California is broke? This video I did, the percentage of all operating revenue that comes from Washington to the states on average has increased mightily since the early 90s. And California's has increased even more than that. And they're getting a lot more than the average. And so is Vermont. So, yeah, we'll ship spread the costs around all states so we can get taxpayers from 49 other states to pay for this crap. But who's going to bail out Washington when they run out of money? Oh, yeah. 57.7% of all Medicaid spending was from Washington in 1992. Now we're going to run to 2000. Jumping to 2000, Medicaid expenditures were 19.5% of state expenditures. And state expenditures grew against the rate of inflation. So Medicaid is growing much faster than all other spending. In 2000, 56.7% of federal funds of Medicaid expenditures were federal funds. Now we jump to 2005. Medicaid, this happened a couple years before this actually. Medicaid is the largest category of state spending in 2005, accounting for 22.9% of total fiscal 05 expenditures, with elementary and secondary education the second largest category at 21.8%. So it's blowing everything out of the water. Again, this is long before ObamaCare came down the pike. Again, there you go. Medicaid is 22.9% in fiscal 05 of all state expenditures. It's the largest single item by itself. It used to be secondary and elementary education for eons, but not anymore. And there you have it again. 56.7% of all Medicaid spending is taken care of by Washington. Here we go to 2010. Oh, looky here. Medicaid's 22.3%, so it dropped just a hair. It was 22.9, now it's 22.3. It's still the largest. That just means, though, that it didn't grow quite as fast as the other expenditures. May have fallen just a hair, but it didn't grow as fast as the other expenditures. So we got it's down to 22.3. It's still the largest one by far. And of course, 2010, everybody was pleading, the states were pleading poverty, as they always do, because we're out of money. They're always out of money. Well, looky here. In 2010, 64.6% of all Medicaid spending was provided by Washington. That is a huge jump from the other time periods we looked at. Huge. Huge. Can I say that? Here's 2016. Medicaid is 28.7% of all state expenditures in fiscal 2016. 28.7. Do you see how it is just blowing everything else out of the water? Beginning January 1st, 2014, this is an important note. State Medicaid programs had the option to expand eligibility to cover non-pregnant, non-elderly individuals with incomes up to 138% of the federal poverty level. The costs for these newly eligible for coverage were fully federally funded in calendar years 2014, 15, and 16. Beginning January 1st, 2017, states that expanded Medicaid began paying 5% of the cost for the newly eligible individuals, with that amount increasing to 6% in January 2018, 7% in January 2019, and 10% in January 1st, 2020, and thereafter. As of October 2017, 31 states and D.C. have expanded Medicaid. Several other states are debating. They're debating the issue. Whether they should expand a program, it's already on basically autopilot. There it is again, federal funds, 61.8%. So the federal government's still going to shoulder most of the burden. So if you expand your Medicaid program into oblivion, yes, it's going to hurt you, but you get at least spread some of the costs out to states that don't have poor people everywhere, like, for example, California. I like how the South is always ridiculed as the dumb, toothless, penniless, poor rednecks living in trailer parks and driving rusted-out pickup trucks. California's got plenty of poor people. But, of course, if they have their way, they're going to expand Medicaid to everybody. Why doesn't California just do that right now? Well, because it's expensive, and they can't pay for it, and no amount of tax hikes will pay for it. So we need an injection of federalism. Medicaid is a program that should be maybe for 3 or 4 years block granted at the rate it was before, to give the states the chance to prepare to take it on themselves. Then California can expand their Medicaid into oblivion, and when they run out of money, maybe they'll realize that onerous regulations and hostility towards the free market would be a little bit better to help poor people. And of course, we need an injection of personal responsibility, as I've mentioned in many of my videos. There's a lot of children growing up without fathers. The nuclear family has been destroyed. Hey, if you don't want to have a nuclear family, that's fine. Just don't come to ask me to pay for it because I didn't cause your problems. Just like if you go out and have promiscuous sex, and we have legalized abortion, in case you know, you choose to have these kids, don't punish me for your mistakes. If you go out and have promiscuous sex and you get AIDS, I feel bad for you, but I'm not going to give you a dime, and I shouldn't have to. Don't be stupid. That's why people have parents, because kids will destroy themselves, and we need an injection of personal responsibility. And California is the antithesis of personal responsibility. California is a progressive petri dish, and it has failed, and people like Bernie Sanders want to do that for the entire United States. People like him need to be kept as far away from the White House as possible. And if I had my way, we wouldn't have keep them as far away from the Senate and House as possible. These guys are crazy. So, in my opinion, you should vote liberty, vote libertarian, because folks, we're broke and there will be a financial reckoning someday. So again, that said, Medicaid was already on a absolute tear long before ObamaCare. It's not that they hated poor people and finally Obama got them to pay for poor people. No, Medicaid was on fire. So I've got the data. Bernie Sanders has talking points, 10-second talking points that they all believe because they're a bunch of cup-drooling autistics who will believe anything he says. Have a nice day, and you've been warned.